Another question that I've had some conversations around this morning, you know, if you talk about, is there a motive here, right? I think clearly there's a mental health component to this. We still need to do some research around trying to get access to certain records and things of that nature, which again, you could probably imagine is not just as simple as just calling somebody, hey, can you send me this thing? But what I would say is, based on what I've heard through conversations this morning, I don't see, or I'm told that we don't have access to any forcibly committed for treatment information reference to Mr. Card, okay? So you can volunteer, as an example, to go to a facility and seek treatment for months on end. But if you're not forcibly committed to seek that treatment, and it's very specific to treatment, right? Not forcibly taken for an evaluation is completely different than treatment. So there are a lot of very specific criteria around firearms, and are you a possessed person, or prohibited person rather, and what that looks like. So in this scenario, we have not seen to this point, I have not seen to this point, that Mr. Card was forcibly committed for treatment. And if that didn't happen, then the NICS check, you could go into a firearms dealer who does all of their work, and the background check is not going to ping that this individual is prohibited. And something that's incredibly important for us to say, and for me to say, and I find myself saying it on a regular basis, just because there's appears to be a mental health nexus to this scenario, the vast majority of people, with a mental health diagnosis will never hurt anybody. They won't hurt themselves. They're not a danger to the community. Based on percentages alone, there's a bunch of folks in here that have a mental health diagnosis. I know law enforcement officers that have a mental health diagnosis. That doesn't mean they're a danger to the community. We certainly have people that reach that crisis level where that does occur, and we deal with those folks on a regular basis, sometimes through involuntary, forcible commitments, right? And sometimes not. Sometimes there's different levels of that mental health system, and that's a whole different conversation that can be quite lengthy. And I can tell you that law enforcement has been involved at this point for decades, and heavily involved over the last 15 years or so.